Hey there, everyone. Happy to have you with us this afternoon. We've got a fun one for you today. So excited about that one. If you have heard of or are afraid of the Quarantine 15, we've got some help on the way today from Dr. Toby Brooks, Associate Professor and Program Director for Texas Tech University Health Sciences Center, the Masters in Athletic Training program there, a kinesiology instructor at Texas Tech University as well. Thank you for being with us today, sir.
Thanks for having me. I appreciate the opportunity.
All right, so tell us a little bit more about your work at Texas Tech University Health Sciences Center and sort of how you got there.
So our program is, it was one of the first 10 in the country of its type. It's an entry-level master's program in athletic training. Athletic training is a allied healthcare profession. More often than not, people will see us on the field. Football player goes down on a Saturday afternoon. We are the ones rendering care, but that's just kind of the tip of the iceberg of what we do. Athletic trainers are involved in the prevention, management, and care of athletic injuries and working with physically active patients. So I've been an athletic trainer a little over close to 20 years now, and I've been at Texas Tech for the past 10. And in my opinion, it's the best program in the country. We've got superb students, incredible preceptors, faculty, myself notwithstanding, I would put up against anybody in the nation.
Well, very cool. So you kind of touched on it a little bit. Let's talk a little bit about the difference between athletic training and maybe personal training, what people see on a day-to-day in a gym or something like that.
Yeah, lots of times people hear that term trainer and it means a lot of things. An athletic trainer is a specific regulated healthcare profession here in the state of Texas. It's regulated by the Texas Department of Licensing and Regulation as a certified and licensed, well, here in Texas as a licensed athletic trainer. Personal training is a different thing altogether. Those are folks who may or may not be credentialed. It's no criticism of them, but it's much less regulated. It's not a licensed profession. Some certified personal trainers will have a certification. Others, maybe they do, maybe they don't. There are also boxing trainers. There are equine trainers. There are corporate trainers, but we are a specific healthcare profession.
So let's talk about, the healthcare side of staying sort of active, staying healthy during a time when gyms are closed. We don't have access to all of those outdoor activities perhaps that we had before. People are really concerned about that. How do you kind of maintain those fitness goals during the COVID-19 quarantine?
Yeah, I've really viewed this for myself personally as a time to really refocus my own fitness goals. I've been fortunate enough that the garage has been repurposed as a fitness space. Time has never been something I had a lot of extra of. I've got a daughter who's a junior in high school and a son who's in 8th grade. We're constantly busy. So the thought of taking an hour or 45 minutes to go to the gym, work out, another half hour to get home, that always seemed like wasted time for me. So now I've got that time here that I'm not commuting. And so it almost feels like a bonus in some ways. But for a lot of people, they really miss the social aspect of fitness. They draw a lot of motivation from working out with other folks. And to me, that's kind of the missing piece. Time's on your side, but you may or may not have the equipment, and you certainly won't get the social aspect that going to the gym would offer you. So gotta get creative. I've seen folks develop Facebook groups relatively quickly. Other folks who have just taken to calling or Zoom conferences with their friends to make sure they stay on track. But it's really just kind of settling in. This is not a hurricane or an earthquake where, a week or so later, much of the country's back to normal. We're in this for the long haul, so we've got to find a new normal.
I did a Zoom yoga class the other day, and it was lovely. It was really it was kind of a nice, moment to kind of get away from the normalcy of what we've been doing lately, it seems like. So let's talk about those at-home gyms. If we're working to kind of build one, we could certainly get on Amazon, I suppose, and order some, equipment. But also maybe we have some stuff at home that we could use, right?
We do. There are basically anything with mass can be used as resistance. So whether that's soup cans, jugs of water, you can get creative. I've got medicine balls, resistance bands. I'm a big fan of elastic and resistance bands, just simply because they don't take up a lot of room. You can throw them in a bucket, toss them in the trunk of your car, go to the park, get outside and do those things. Whereas if you've got, dumbbells or barbells, those things are heavy, and it just doesn't, it's not real conducive to going somewhere else and doing it. And I think for me, this time has been one of just trying to kind of reconnect with some things that the busyness of life has eroded. And so getting outside and working out is a beautiful thing. So I can show you some bands and some other things that I use from time to time. They're relatively inexpensive. They're super versatile. There's a million different exercises you can do with them. And, at least before the pandemic, they were readily available. I think there's probably some shortages online these days. I've got some friends on that Facebook group that I'm with, and they said they found a pair of dumbbells on Craigslist, and they were like $400. And, a week before they were selling for like $25. So some fitness opportunists out there that are price gouging, unfortunately. So we have to be aware of what's available alternatively.
So if you can't get those things like dumbbells and things like that, you've heard the term like body weight exercises, or using your body weight to build, to do those weight training. What does that mean, and is that effective, and how can we do that?
Yeah, I use an app called Fitbod, and a lot of people, people used to, well, I don't know that they said it, but in my mind, I thought, well, it's my job to be able to develop fitness and rehabilitation plans. I don't want to use an app for it, but I was using that as a barrier, and it kept me from being regular about my fitness. At the end of a long day teaching those things, the last thing I wanted to do was sit down and script out a plan for myself. And it was also hard for me to track my progress. And so I use an app called Fitbod. It is a premium app. You have to pay for it. I think it's like $50 a year. There are some free alternatives out there, but most of those apps will have like a travel feature that's built in, where if I don't have access to a gym, I can do some bodyweight variants, whether those are squats, burpees, lunges, various different alternatives, planks, and it doesn't require any additional resistance at all. And that can be a nice alternative from time to time, but in this time, if you don't have the equipment, it's kind of the only thing you're left with.
So Fitbod, right? Am I here? Mm-hmm. Okay, something to check out for.
I believe it's only available for iOS. It's only an Apple app. Another one I've used in the past is called Shred. Nike makes or markets a Nike Fitness Center app. They have a running app along with a resistance training app. So, just kind of have to do your research and figure out what you can afford, what fits well with what you're doing, and just kind of go from there. But Fitbod's work for me. I love it because it allows me to kind of track my loads over time, and it's periodized, which means I'm less likely to overtrain myself because it will adjust on the fly.
Interesting. Very cool. I also want to talk to you today about a population that has been advised intensely to stay home and to stay in that, social isolation a little bit. Senior citizens, what can they do to make sure that they are maintaining their fitness level at home, and maybe without somebody advising them, keeping that eye on them that they might be accustomed to?
Yeah, teaching athletic training for special populations course, and we just talked about working with elderly patients today. There's nothing necessarily dramatically different about this group, other than we're probably going to progress a little slower. Balance issues can be a problem, so I'm going to have them do more things from a seated position or in a real stable base, so that I can mitigate any fall risks. I may progress them a little slower than I would with a younger patient, or use less resistance. So body weight variants, things like getting it up and down from your chair with control could be one thing we do. Just going for a walk, if you've got an Apple Watch, you can count your steps, whether that's around the house, literally around the house, around the neighborhood, if that's an option for you. But if they're trying to stay indoors, just going from room to room would be better than the temptation there to just sit on the couch and endlessly watch Netflix. My mom's a big Fitbit person, and when they'll come to visit us, we'll be in the middle of just hanging out, and she'll get up and start walking around. I've got to get my steps in for the day. whatever that motivator is, I'm all for it. Anything we can do to stay active can help stave off that quarantine 15 you talked about.
It's a real thing, right?
Yeah.
Okay. Anything else that you kind of want to share with us before we let you go today? Make sure that we get it all covered.
I will be posting resources on my website, but it's kind of the beautiful thing that I've seen from this whole pandemic situation is we're all in this together, and a lot of people who are remarkably smart and always sell their stuff, and I'm not including myself in that, but I'm saying fitness professionals, even professional athletes, they're posting things to their accounts for free that ordinarily you'd have to pay for. So it probably would behoove folks to just do a little digging and see what you can find in terms of free resources, because they're out there. Folks are looking for something to do, and they're looking for ways to contribute to this effort. And I've got some great friends who usually will sell their products for hundreds of dollars, and they're making it available for free just because they want to be kind of a source of good in the midst of what otherwise would be a pretty crummy situation.
Very cool. Okay, so that wraps up the hard part of the interview. Now time for our lightning round. Are you ready?
I'm ready.
You got to answer these from your gut, okay?
Okay.
First question, crunchy or smooth?
Smooth.
Oh, good. That was a definitive answer. Okay, we're talking about staying healthy, but everybody's got to splurge sometimes. What's your favorite quarantine carb?
Frozen fruit. I'll do 2 or 3 protein smoothies, but the fruit is what makes it good. The protein is what makes it good for you.
I mean, I was thinking French fries or pizza, but okay, we'll take what we can get from you. All right. Are you binge watching anything while you're doing your workouts or after you're done?
My kids have got me started on the Marvel movies, so we've watched a couple of those. 2 nights ago was my son's birthday, and ordinarily we would take him to the movies. We couldn't. So we pulled a monitor out in the garage, and we watched Captain Marvel laying in sleeping bags in our driveway.
So cool. That's a great idea for our families out there as well. Nice. Last question. Second to last question. I thought of another one. What's your favorite workout playlist? What do you have to have going while you're working out?
I have a clean hip hop playlist. I'm a drummer. I like the beat, but I can't get with the filthy lyrics. So there's a clean lifting hip hop playlist on Spotify that's a go-to for me. Also, Motiversity is another one where it's kind of motivational speakers over hip hop beats. It's pretty awesome too.
All right, I like that. Okay, last question. You've worked with athletes throughout your career. Anybody that you are sort of like starstruck by that you've worked with?
I interned with the Oakland Raiders back in the day, and I took pride in not getting starstruck. Like in your mind, you tell yourself, I deserve to be here just as much as they do. But when Jerry Rice walked in the room and Tim Brown was right behind him, 2 Hall of Fame wide receivers, I was kind of stopped in my tracks and realized, wow, this is a pretty special moment. I didn't ask for autographs or anything, but I was more tempted with those 2 than probably any others.
That is awesome. That is so cool. Dr. Toby Brooks, thanks for being with us today. We appreciate your time. Great advice.
Thank you, Megan. Appreciate it.